A Save the Children report released on Tuesday has found that better healthcare and more girls attending school have knocked Afghanistan from its position as the worst place on earth to be a mother. Afghanistan has switched places with Niger and West Africa in Save the Children's Mothers Index, which fell back to bottom place, a spot Afghanistan had occupied for the past 2 years.
There has been progress with mothers and children in Afghanistan. 10 years ago there was not one girl in formal education, and now there are 2.5 million girls in school, and more girls are staying in school longer. So this is a huge achievement. Previous years there was such high levels of mortality for women and children that every mother in Afghanistan was at risk of losing a child in her lifetime. Now more mothers are surviving and fewer children are dying. And again, this is something that we need to be celebrating.
Afghanistan's move from bottom place was partly achieved by the number of births attended by trained professionals in Afghanistan rising from 14 to 24% between 2003 and 2008, and girls in formal education, which has gone from 0 in 2001 to 2.5 million today. Rick Manning, who's the medical director at Cure International's hospital in Kabul, said there was encouraging signs that life for mothers and children was improving.
I hope it's due to the fact that the other countries have gotten worse and that we haven't gotten worse. But I think there has been some improvement. There's some encouraging signs. There's been some encouraging reports. There's still a tremendous need, however.
During the rule of the Taliban, women were denied access to general hospitals from 1998, causing their health to deteriorate and the child mortality rate to shoot up. The executive director for the Cure Hospital said the result of maintaining reproductive health for young mothers means a reduction in mobility and mortality rates in Afghanistan.
I won't see this going away with any changes in the country, but it's a plus on the sustainability of the reproductive health and the reduction of mobility and mortality.
Afghanistan suffers from a huge divide between urban centers, where women have more access to healthcare and education, and the rural areas, where life carries on as much as it did during the time of the Taliban. Jessica Minton, IB Times TV.